Hello, my name is Aleksandra Kagan, and my partner, Madison Zigmont, and I are both members of the Sister Nora Harrington Honor Society at Elms College. We are both senior nursing students graduating this May. The title of our project is Knowledge of Infection Prevention and COVID-19 among Elms College students. We decided to research this topic because we both have a strong interest in learning about COVID-19 since the beginning of the pandemic. There is still a sufficient amount of information that the general public and healthcare professionals do not know, as guidelines and information are constantly evolving. However, there are reputable sources, such as the CDC, that have evidence-based practice guidelines that can be utilized to prevent transmission of diseases such as COVID-19. After completing a literature review of 10 current articles, we concluded that having correct information about infection control practices and COVID-19 has a positive correlation with increasing compliance rates. Amidst the current COVID-19 pandemic, correct infection control knowledge and adherence are necessary among the public in slowing the progression of transmission. It is crucial for all members of society to value their role in protecting not only themselves but others as well. Evaluating knowledge on proper hygiene practices is essential when assessing the community's readiness to protect against COVID-19 outbreaks. Communities such as college campuses are especially susceptible to disease outbreak due to the lack of adherence among students and crowded living conditions. This population is also at an increased risk due to gaining information from non-reputable sources, such as some social media apps. The objective of our study is to examine knowledge deficits among students and determine interventions that will ensure compliance on campus. About our study, we created a 13-item Google Forms survey to assess the knowledge of Elms College students. The first 3 questions that we created provided demographic information about students. The remaining 10 questions assessed infection prevention and COVID-19 knowledge. These were based on the information that we found in our literature review. We also collaborated with Jessie Chenier, RN, from our college's health center in reviewing the relevance and accuracy of our questions. Each of these 10 questions were worth 1 point if answered correctly. After obtaining approval from the Institutional Review Board, we were granted permission to send the survey out to all students of Elms College email addresses. The survey was sent out on March 15th and was open for approximately 1 week. For the results of our survey, it was completed by 118 students. 62 respondents identified themselves as nursing or science major. The remaining 56 students identified themselves as other majors. The average score on the survey was 7.36 points out of 10. Over 80% of the students correctly answered questions regarding correct length of hand washing, the main transmission route of COVID-19, when do symptoms of COVID-19 appear after exposure, and that it is necessary to continue wearing a mask after being vaccinated for COVID-19. There were 2 questions that were frequently missed in our survey. Only 27% of the students on campus that answered the survey correctly answered that air in a room can be contaminated with COVID-19 after an infected person has left the room for up to 3 hours. 39% correctly answered that wearing a face mask reduces your risk of contracting and transmitting COVID-19 by 95%. Based on the results of our study, Elms College students have a good knowledge of basic concepts of infection prevention. On average, students correctly identified methods to prevent COVID-19, such as wearing face masks and eye protection. They also performed well on questions regarding vaccinations, as a majority of students understood that a vaccine will not give you COVID-19. These results suggest that students are obtaining their information from reputable sources and value their role in protecting others. The findings from our research project makes us hopeful that Elms College students will continue to adhere to guidelines and infection rates will remain low on our campus for the duration of this pandemic. Thank you so much for listening.